and symptoms of stomach cancer and what to do. Your stomach is a hollow muscular organ located in the upper middle of the abdomen. It is an essential organ that aids in the breakdown and digestion of the food you eat. But what happens when it develops a disease like cancer? Stomach cancer is an uncontrolled growth of poorly differentiated cells in the stomach that damages its tissues and disrupts normal functioning. Chronic stomach inflammation and ulcers are considered to be one of the leading causes of stomach cancer. Indigestion or heartburn is one of the early symptoms of stomach cancer. Heartburn is caused by acid reflux into your esophagus because the sphincter muscles at the end of your food pipe cannot contract. The acid reflux may be due to underlying problems like GERD that lead to the formation of cancer. Persistent pain or discomfort in the abdomen can also indicate gastric cancer. The cancerous cells may cause damage to the surrounding tissues, resulting in inflammation. The inflammation causes an increased blood supply to the area and causes fluid to leak into the surrounding tissues. The swollen tissues push against sensitive nerve endings. As a result, you experience pain. Nausea and vomiting right after eating food can be a sign of stomach cancer. Vomiting is the body's mechanism to get rid of harmful substances in the stomach. The buildup of toxins inside the stomach due to cancer may induce vomiting and nausea. Stomach cancer may also result in inflammation and irritation of the gut, resulting in vomiting and nausea. In advanced stages of stomach cancer, you may vomit up blood as well. This condition is called hematemesis. Recurrent vomiting may cause damage to the microvasculature of your digestive tract, causing bleeding. Damage to the stomach lining and bleeding from lesions can also make you vomit up blood. Your stools may also appear dark due to the presence of blood cells in them. If you are experiencing a persistent change in your bowel habits, it may be a symptom of stomach cancer. Diarrhea and constipation are among the major complaints of people with gastric cancer. Stomach cancer alters the normal functioning of your digestive system and causes watery stools. If the cancerous tumors press on the bowels, it can make bowel movements difficult, resulting in constipation. Sometimes the cancerous tumor grows and presses the nerves passing from your spinal cord. This can also affect your bowel movements. Constant abdominal heaviness and bloating also indicate stomach cancer. Abdominal bloating usually occurs after eating meals due to excess gas production. In gastric cancer, the normal movement of the digestive tract muscles is affected. A lack of bowel movements makes stools stay in your intestines for prolonged periods. The longer your stool remains in the colon, the more bacteria gets involved in the fermentation process. This bacteria releases gases in excessive amounts, resulting in bloating. A loss of appetite is a common manifestation of stomach illness and cancer. The bloating and inflammation may contribute to early satiety and loss of hunger in stomach cancer patients. The growth of the tumor may also occupy the stomach space, causing an appetite loss. Constant nausea and vomiting may reduce your appetite as well. Cancers often cause unexplained weight loss. In stomach cancer, your digestive system is disrupted. The lack of appetite may be the possible reason for weight loss. Additionally, the body produces cytokines to fight off cancerous cells. These substances can also cause weight reduction, muscle loss, and appetite loss. Many people with stomach cancer complain about the sensation of food getting stuck in their throats while eating. This symptom usually occurs in the advanced stage of stomach cancer when cancer starts to spread, causing inflammation and narrowing the food pipe. The gastric tumor may grow in size and narrow the food passageway itself. Weakness and fatigue are also common in stomach cancer patients. Fatigue occurs when the healthy cells get damaged by cancer, and your body tries to recover from the damage. Other symptoms like nausea and vomiting may also lead to fatigue and tiredness. Your doctor will take a detailed medical history and ask questions about your symptoms for an accurate diagnosis. If stomach cancer is suspected, your doctor performs several tests depending on your symptoms. Imaging tests like CT scans, ultrasounds, and X-rays allow determining the site of cancer and overall health of the affected organ. You may also undergo a biopsy. A biopsy is a procedure involving removing a small number of tissues from the affected area for examination under a microscope. A biopsy may help identify the type of cancer. Your doctor may also recommend an endoscopy for a detailed analysis of your stomach. An endoscopy is performed by inserting a thin, flexible tube with a tiny camera attached to it down the esophagus and inside the stomach and small intestine. Some people may need to go through a laparoscopic procedure to determine if cancer has spread to the abdominal cavity lining or surrounding organs. The results from the diagnostic tests are used to determine the stage of cancer. After an accurate diagnosis, the treatment for stomach cancer begins. In some cases, doctors recommend surgical removal of the cancerous tumor along with some surrounding healthy tissues. Your doctor may also remove the regional lymph nodes during surgery because cancer might have spread to them. In advanced stages of stomach cancer, surgery is not recommended as the primary treatment. Surgeries are usually followed by chemotherapy. Chemotherapy involves the use of drugs to kill cancer cells by halting their growth and division. Targeted therapy may also be used to fight off stomach cancer. Your lifestyle and dietary habits play an essential role in managing the symptoms or even preventing stomach cancer. A healthy diet full of vegetables and colorful fruits keeps your gut healthy and calms down an irritated stomach. Alcohol and caffeinated drinks can damage your stomach, causing acidity and ulcers, leading to gastric cancer. Therefore, it is best to limit their consumption. An antioxidant-rich diet can be beneficial in reducing the risk for stomach cancers. You should also avoid heavily processed and junk food. Being overweight can increase the risk of stomach cancers. A healthy weight and active lifestyle might lower your risk.